Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates.
Let's look into the scissors. So here scissors, it includes a Mayo scissor. So Mayo scissor, the design is it is long and scout. The use is it cuts the sutures. So it is used to cut the sutures and cut through the linea alba. So linea alba is cutting through, and then the aponeurosis. Next also the sheath and the ligaments. Then we move on to the Metzenbaum scissors. Metzenbaum scissors, it is designed, it is lighter than the Mayo. It is lighter than the Mayo. There is a short blade and a long shaft. Short blade, long shaft. The uses is it is used for fine dissections. So fine dissections. Then we move on to the, so we saw the Metzenbaum scissors. So fine dissections as well as cutting the delicate structures. So delicate structures can also be pierced through, such as the peritoneum. So peritoneum, then come dissecting the sac from the cord, then cutting the intestine during the resection and the anastomosis. So cutting the intestine during the resection and the anastomosis. Then we move on to the Lister bandage. So Lister bandage scissors, it is the design is there's a distal blade bent at an angle. So it is bent at an angle. So when you see a scissor with a bent at an angle, it is a Lister bandage scissors most likely. And the lower blade with a flat, the lower blade, it is with a flat. There is a blunt non-traumatic tip. There's a blunt non-traumatic tip is also present. So what is the use of this Lister bandage scissors? The use is it is for the cutting the bandages. Cutting bandages.
To learn and grow daily like this, please do subscribe.